A piece of advice that I would give professionals, especially when someone's on dialysis, is to really speak up regarding, hey, you don't have to be on dialysis forever. There's another choice to that.
When I heard about transplant, all I heard about were negative things, like the cost of immunosuppressants, failed transplants, people dying after transplant. I never heard anything good about it, because I never saw anybody who had a transplant.
It's not an everyday conversation that's happening. I think the scope is really just solely looking at the here and now and how do you manage the dialysis that you're on.
Maybe you feel like it's something that has passed you, that you've sat in the chair so long that the option isn't available to you.
A lot of dialysis centers are telling patients over 60 that they won't get a kidney, and that is wrong. It should be up to the transplant centers to make that determination, but to get somebody waitlisted, if their labs are good, they need to push that issue.
Fortunately, I had a social worker who always said, keep your options open, and that's what I did.
Ask your social worker, ask the technician, when your doctor comes, tell them you want to see the doctor because the doctor has to refer you.
When most dialysis patients try to get waitlisted, it can be very discouraging.
There are a lot of tests you have to take in the beginning, and there's a lot of pre-work that has to be done. If you're not going to dialysis frequently or if you're missing appointments, that really has a bearing on what you could do in the future.
Keep in mind, you want to be healthy. You want to qualify. You don't want your health to decline because you're sitting in the chair.
A lot of times, patients have to be their own advocates because I didn't know that you could be listed on multiple lists.
I wasn't told that I had more than one transplant center to go to. I had faith in my professionals that they were sending me to the right transplant center, and not saying that it wasn't the right one. But if I knew ahead of time that I could list in more than one center, maybe my transplant would have happened sooner. Maybe I would have had a different experience. I think the assumption is that now that you've had a kidney transplant, there's some maintenance, but it's less maintenance. But I would argue to say that it's probably the same level of maintenance that you have to do. You have to watch your diet.
You have a medication regimen you need to follow. You need to be much more healthier. So you can't go back to doing what you was doing because all you're going to do is kill your kidney.
With having a kidney transplant and kidney disease is still there. I still have good days and I have bad days. You have to go to your appointments on a regular basis like you're supposed to, every 3 months, 2 months, however the doctor, wants you to come for your visits.
One of the transplant nephrologists at my clinic, he stated, one day off of dialysis is better than your best day on dialysis. I would tell any dialysis patient to please consider transplantation. And if there are any questions that the dialysis centers won't answer, then I encourage them to call their networks or talk to anybody that has had a kidney transplant and just to be able to dialogue with them.